This is Bianca Martinez, and I'm going to be doing my video of inserting a Foley catheter into a patient. We're going to begin by looking at the patient's medical record to see if there's anything that's going to be preventing us from inserting the catheter. Once we confirm that everything is okay, we are going to go ahead and enter the patient's room. Begin by knocking on the door, hand hygiene, provide privacy. We are going to introduce ourselves to the patient. Hi, my name is Bianca. I'm going to be your nurse today. And then you want to let them know that we are here to insert a Foley catheter into them. Before you start with anything, you want to identify with two different identifiers that you have the correct patient. This could be their name and date of birth. Once you have confirmed that you have the correct patient, we're going to put them up a little bit put them high enough until they're on our waist level, lowering the head of the bed just a little bit. We're going to go ahead and put on some clean gloves. Once you have your gloves on, you're going to go ahead and look into the patient's labia and make sure you have located where it's going to be. We're going to dispose of our gloves. We're going to let the patient know we're going to go ahead and go grab our supplies and be right back. I already have my supplies right here. We're going to go ahead and open it. And we are going to be making a sterile field as we are opening the package. And you want to try to avoid it just touching anything inside of the drape because everything is sterile. You have a pair of sterile gloves that you're just going to put aside. There's the drape. Without inserting. This one goes right underneath the patient, having them lift with their hips a little bit. And underneath the pad, you want to ensure that there is one of the mats that's going to resist from any wet materials getting onto them. Once you have the drape underneath them, there's another drape that you actually put over them while wearing gloves as well. Okay. We are now going to go ahead and put on our sterile gloves. Now your sterile gloves are on. You want to open the lubrication packet, squeezing it onto the tray. You're now going to open the swab sticks. To clean the area, we want to make sure with the non-dominant hand, we're going to open the lips of the vagina. Now that you have put your hand onto the patient's vagina, it is now contaminated. So you want to ensure you keep it on there without touching any of the equipment. You're going to clean the sides of it, one swab for each one. You never want to use the same swab, swiping from the top to the bottom on the sides, and then straight down in the middle. Now you're going to pull out the catheter. Holding it. Inserting the catheter. And as they start to go in, you're going to see some urine come out. And then push it in 1 or 2 more inches. If you start to feel restriction, don't push it any further. Now we're going to get the syringe. Uncap it. And you want to make sure you use the whole solution that is in the syringe. Once you have entered all the solution, we are going to attach part of the catheter, the pump, onto the patient's legs so they have some movement. Once you have attached it to their legs so they have some mobility, we are going to ensure that the bag is clipped onto the side of the bed lower than their bladder. Actually, before you did that, you would remove your sterile gloves and place another pair of clean gloves on. Once you have your clean gloves, then you clip it onto the patient's, tape it to the patient's leg to secure it so they have some mobility, attaching the urine bag to the side of the bed, ensuring it is not clipped onto the bed rails. Once you have attached their bag below them, you're going to dispose of all the equipment that was used, providing frequent personal hygiene to the patient vagina. Once that is done, we are going to hand hygiene, ask the patient if they have any questions or need anything else. Hand hygiene again, document that you inserted the Foley, and that is my video for inserting a Foley catheter.